Jonard.
Jonard.
Yeah.
Okay. Jonard is a therapist?
Yes.
Injured himself 4 years ago, and just describe your injury.
It was a twisting injury.
Transferring.
Transferring, basically.
And immediately you had?
Back pain and left leg pain with numbness on the left heel, lateral side. And back pain went away 3 days after. That radicular symptoms persisted up to now. You know, up and down, up and down.
And you have foot numbness.
I have foot numbness sometimes, occasionally. You know, now, like whenever I do something more, then the whole foot goes numb on me.
Have you had I didn't ask you, did you have an MRI?
MRI showed some bulging of the disc in L4, L5 level with encroachment of the L4 nerve root. That's it. That was like 2 years ago when I did the MRI.
All right, now, are your symptoms getting any better or any worse?
It's stable. It's, you know.
So in the last year and a half, you're not getting any better?
I haven't had, I'm not back to my usual. Before the accident, training to run the marathon, I've been, you know, very active. Since then, I haven't done anything. I've gained like 20 pounds since the injury.
But in the last 9 months, you're not getting any better? You're not getting any worse?
Yeah.
If it was a full-blown disc problem, and I would be worried about it, I would think that he would be getting worse or better. He's not going to stay the same, and the symptoms are not going to be intermittent. He says that he has numbness down his leg when he has a bowel movement. Okay? He has numbness down his leg when he sits and drives his car for more than an hour and a half, 2 hours.
Yes. About that, about 2 hours.
Okay. So from the history, I know that if he tests positive, which I'm sure he's going to, I know through experience and from what he's telling me, I think I'm going to have to go into the rectal fossa because of his history. So this kind of, by what somebody tells you. And then what also would tell me is that I'm going to have to treat him more towards flexion than towards extension, because his worst symptoms are when he's flexed. So I want him to be able to function very well in a flexed position. You don't have too much trouble standing or short walking?
No. Well, prolonged standing.
Or prolonged standing.
I have pain, increased numbness with prolonged standing.
All right, which is worse, sitting prolonged or having a bowel movement or prolonged standing? So bowel movement is the worst. Okay, so, and it's down this leg. Think of your anatomy. So we're coming right down, descending colon, sigmoid colon, rectum. So everything's kind of falling into place, isn't it? Okay, you want to take your shirt off and then we'll...
Sure.
Shirt, yeah.
What was the injury again?
A twisting injury. Just gonna... All right, walk around your tiptoes, please. And then on your heels. Okay, so that's a pretty good test for the nerve roots to see if he's got a drop foot or he's got, you know, right? All right, so now I'm gonna, you want to just turn here? Sorry, bend front. Back up. Bend front. Back up. I had a patient, we was in a small clinic, so I say bend forward, back up, and she goes. and I didn't think, so I did it again. Next thing I know, I was standing out in the waiting room with this woman here. So now I say come back up. All right, come back up. All right, go. Bend forward. And back up. And forward. See, English language is really funny. You know, it means a lot of different things. So, okay, so he seems to clear as far as symmetrical movement, and I don't really have to go too far up there because it's he's talking about things that are going on between L3 and down, right? Yeah, just like we did in the, yep, you're looking for symmetrical movement. At the sacrum, there should be no movement. At the lumbar, there should be movement. Because the sacrum is locked and your lumbar is supposed to move. So the PSIS should not move. If it moves, that means it's moving with the, and it's in dysfunction on that side. We're going to go over that later, okay? All right, I want to sit here and we'll do through the slump test. And straighten this leg out and lean forward. That he told me last time that it was tight hamstrings,
Yeah.
okay? Now it's the same thing there, lean forward. That you said that's soreness in your back? Was that soreness in your back? Before you had soreness?
Well, I have soreness right now.
I'm sorry?
The soreness has been there since the drive last night. So
Does it increase it to do this?
it increases some sensation
Okay.
right now.
Now keep your leg up and keep your bend, but just lift your head up and throw your chest out slightly. What does that do?
Oh, then we're pulling on the back, behind the knee.
Okay. So we're really stretching viscera at that time. We've taken off the dural stretch, right? So sometimes that's a good indication that there's a visceral problem. So what I did is, now let's just go over this real quick. If the leg's straight and I bend forward, I'm putting a dural stretch on, right? If someone says I don't have any pain or I have a slight bit of pain, and then I take the dural stuff off and have them lean further forward, which means I'm compressing the viscera more, and it increases their pain. It doesn't say for sure that there's a visceral problem, but it indicates that there could be. You see where I'm coming from? I took the pressure off the dura and increased the pressure on the viscera. So that's just another test to lead you towards a conclusion. Okay? Good, now let's lie down on your back, please. I normally would do straight leg raise tests, etc., etc., etc. But we're not going to do that now for the sake of time. All right, want to just put that leg straight. Hold this leg up here. Now, so that we don't cheat right-handed to left-handed, you do the flexion test like this. Okay, just lean into it. Don't use your arm. And this back down. Yep. Hold. Hold. He can't really hold me. That's tough to hold, okay? You can move up a little bit further if you want. There you go. All right, hold, turn your toes in. Hold right there. Don't let me push in. Okay? That hurts?
Yeah.
And it's weak.
I'm left side dominant too.
Your left side, you're left-handed?
Yeah.
Okay. And I'm checking for internal rotation of the hip, so I block here and roll this in. Look at this one. See this? That one stops right there. So that's positive for internal rotation. Bring your leg up here like this, like that. Let your legs flop out to the side. I'm going to overpressure it slightly. Is there a difference? No. Okay. Get this down. Hold right there. Toe straight up. Don't put your leg into the table to stop. Just hold. Don't let me pull this leg out. Now if his body moves because he can't stabilize, that's positive. Okay, but he couldn't even hold me. I could still beat him. Okay, and this arm should not, and body should not be able to break that leg. And hold again. Don't let me come out. See that one? So it's positive on that side. Turn over on your belly.